Aortic aneurysms are dilations of the aorta, kind of like a balloon, and the larger they get, the more at risk you are for rupture. When an aortic aneurysm ruptures, a patient bleeds very quickly into the area kind of behind their organs and along their spine. It's certainly an emergency situation. Aortic aneurysms can occur in any part of the aorta, which is the largest blood vessel in the body. Most commonly, they occur below the renal arteries, or below the arteries that go to your kidneys, down in your abdomen. Less commonly, they can occur up in the thoracic aorta, up in your chest, or in the thoracoabdominal section, which is between your chest and in your abdomen, or spanning between the two. Thoracic and thoracoabdominal aneurysms unfortunately don't have any symptoms until they rupture. And so they're often incidentally found on a chest x-ray or on an ultrasound for another reason. Because of the increased morbidity and mortality with incisions in the chest cavity to fix thoracoabdominal aneurysms, the technology has now developed that we can now treat those endovascularly with fenestrated endografts. And that allows us not to make any large incisions in the chest or in the abdomen. Endovascular aneurysm repair is where we actually go through the femoral arteries in the groin and are able to take a graft like this one and move it up through the blood vessels, constrain down inside a little tiny sheath, and then deploy this to cover the aneurysm. As you move higher and higher into the aorta, the repair becomes more complicated. And you can require specialized grafts that are tailor-made specifically to the patient, called fenestrated endografts, that have little holes in them that are made specifically to the patient's anatomy and line up exactly with the patient's arteries for their kidneys and for their bowel. At Vascular Institute of the Rockies, we have an entire team of surgeons, from endovascular to open surgical specialists, that can treat the entire aorta, all the way from the aortic arch down to the pelvis and the iliac arteries. Recovery time after open surgery for thoracoabdominal aneurysms is often a week or 2 or 3 weeks in the hospital, followed by 2 or 3 months of recovery. Endovascular aneurysm repair has revolutionized what we can do, especially for the patient recovery. Oftentimes, patients leave the hospital the next day and are back to leading normal lives within a week or 2.